We'll give it just a minute, let people join us. All right, so how's it looking there, Bob?
Yeah, we're getting some people trickling in.
All
We'll
right,
give it another minute or so, 30
Yeah.
seconds to a minute.
so we're excited you guys are going to join us for this little chat. Give us just a minute, let a couple more people jump on. Are you ready?
Yep, I think we're ready.
All right, very good. Well, we hope that you've had a really great day. Oh my goodness, all the information has just been amazing throughout this. And what we wanted to do now was, you've heard a lot about from the different doctors on the different things and the different trials that are happening. And on our board, we do have 3 people that have been in clinical trials before. So we thought, what a great idea to share, because before any of us became hypopara, we might not even have known what a clinical trial was or how do you get involved. So we thought we would ask them real life experiences. So I've got, of course, Deb right here with me, who's going to share a little of hers. And we've got Michelle, who you've been seeing all day. And we've also got Barry remotely there, who have all been in a clinical trial. So I'm just going to ask them a couple questions and be able to share with you. So we're actually going to start with Deb, because she was the first one to be on a trial. And we really just wanted you to share with us, how did you even go about finding a clinical trial? And, what did it mean to you to be part of that clinical trial?
Okay. After the first conference I went to in California, I understood, and I was actually able to think about what is a clinical trial and how do you get involved. And Dr. Levine, I think it was sharing, and go to .gov, clinicaltrials.gov. So I did. I went to clinicaltrials.gov, and I was able to find one at NIH at the time. And so I applied for myself. I didn't have a doctor or anything to do it, because at that time I was on the Navy base. So it's called, you don't really have a doctor. Well, you kind of do. So I was able to go there, and I had to pay for my first trip. But then after that first trip and I was accepted into the trial, then they flew me every 4 months out to NIH, all the way across the country. And I called it my hospital vacation, because I would get to stay there about 4 or 5 days at a time, and they would take care of me. And oh my goodness, the meals were wonderful. But it was a great experience, and it made me feel very empowered that I was able to do something for myself and take care of myself. And I learned a lot. And I met Dr. Gaffney. That's where I met her. So it was very much a very good learning experience.
What made you even want to look into the trial?
My kidney function was already down to 35%. So if I had not probably been in that clinical trial, I probably wouldn't be here.
Okay, so really self-advocacy for sure. Yeah. Okay, very good. And then Barry, we're going to ask you next. Tell us how long you have been in the trial and some of the challenges that you're experiencing, and share with us the trial that you're in, because we all know that. But now that I say that, I think everybody in the world needs to know which trial you're in, and how long have you been there, and some of the things that are a little tougher for you, and potentially the reason why you joined the trial.
Okay, well, thank you, Patty. I am in TransCon phase 2 of clinical trial. My first dose was on December 20th, 2019. I actually sought the treatment before it was available. I went off Natpara back in 2016, and I just couldn't get healthy. So I needed to find some options, and lucky enough, I started with Dr. Rubin, and I started the trial December 20th. 2019, and it was great. I live in Florida, but I traveled back and forth to New York every 2 weeks to be in the clinical trial. And some challenges I faced was one day my medicine actually froze when it was packaged up, and there was no protocol in place to ship the medicine. So I had to fly right back to New York. I literally landed at 7 p.m. and took off at 5 a.m. and went back. And after that incident, they started new protocols to be able to ship the medication. And I'm so thankful to that incident that I had, because without that, I never would have been able to continue in the trial. I have not been to New York since March 17th, 2020, and it's been very difficult. But I am so thankful that Dr. Rubin works with my local endocrinologist and my local nephrologist, and together they're all managing me. It's been a complete team effort. There are definitely many challenges I faced. I was feeling great, and then not great, and then great. And as I feel great, I do more, and then I need more parathyroid hormone. So it's a work in progress, but I'm so happy to be the guinea pig. So eventually everyone can try, get on this medication or a similar one.
Very good. Thank you. Anything else you want to share with the group?
I'm just so grateful to science. I'm grateful to Ascendis, the patient science. I mean, they really cared and listened to my needs, and many protocols had to have been changed because of me. And I'm just thankful to all of them. And, some days I feel great, some days I don't. But as I said, it's a work in progress, but I'm very grateful to be part of this trial. And obviously in the extended phase 3 trial now, the open label extension.
Very good. Thank you so much. And thank you for
You're
being
welcome.
part of it. Michelle, so Michelle is the most recent one to join a trial, so she can share with us that trial. But tell us about, because you work full time, so tell us about what life adjustments you've had to make as a result of that, and some of the really great days, but some of the really hard days as well.
Okay, I do want to mention one thing real quick too, because some people may not understand. So I'm in the same trial technically as Barry is. I'm in the TransCon phase 3 trial. She was in the phase 2. And I think it's important for the community to understand that once you're in the trial, when phase 2 ends and phase 3 starts, they don't just drop the phase 2 patients. She's still in the trial. So that's one thing to know or to expect, that you don't just get dropped when they go on to the next phase. So I think that's important. Yeah, so I do work full time. And when you enter a trial, every trial is different, but all of them have periods of time where you're going to have to really adjust your lifestyle. For the TransCon trial, the first, I would say 6 to 8 weeks were really crazy and hectic. The first week that I was in it, I had to go, because again, I'm like Barry, the site is not near me and I have to fly to my site. And I had to fly twice the first week. The second week that I was in the trial, I flew there, I did all my stuff. I got home and they said they screwed up your DEXA scan and we need you to come back. So I had to fly again the next morning. So I think you have to prepare yourself that if you're going to be in this, you cannot get angry, you cannot get frustrated at the fact that you have to know that you signed up to be a guinea pig, and literally take that literally, and that there is going to be days where things go wrong and it's not their fault. Things just go wrong. The DEXA scan was beyond their control because you get it from an outside facility, and I had to fly back the next day and get it redone. And you just have to roll with the punches. And so there's a lot of visits for TransCon, at least in the first 6 to 8 weeks. I was probably going every week. Then it backed off to every other week. And then I'm in the part of the trial now where we're at once a month. And that doesn't mean it's gonna be once a month if something goes wrong. So a few weeks ago, I don't remember how long ago it's been now, my calcium actually went the complete opposite way. And I went hyper, like super hyper, dangerous hyper. And they didn't know what to do with me. So there was a lot going on that week, a lot of extra visits. So even though they tell you, you only have to come once a month, if something goes wrong, they immediately want to get you taken care of. The good news is they do pay for it. They pay for all my travel. The bad news about that is they pay for it, but they make you pay up front and then they reimburse you. So it is something you would have to work out amongst your family or whatever. Can I afford to front the money for a week or two? You know, that is a consideration. Yeah, but it definitely, it's a lifestyle change. You have to plan, you have to plan these things out. There's been some things that I've wanted to do in the last few months, and I'll be like, I can't do that right now because I have a TransCon appointment coming up, and that interferes, and they tell you don't exercise for a day or two before. So you got to keep those things in mind. So yeah, there's been ups, there's been downs, but I'm just looking at it from the perspective of, I signed up to be a guinea pig so that hopefully someday we can get this medication out there for the entire community.
Absolutely. Very good. And again, you had said to go on to clinicaltrials.gov if they wanted to look at, do you have any other advice for people if they were trying to be an advocate for themselves and look for clinical
Definitely use clinicaltrials.gov. Also, when you come to conferences, so I did sign up for the trials through clinicaltrials.gov, but I initially heard about it at the conference last year, and I heard that they were going to be opening phase 3 TransCon trials. I was on that clinicaltrials.gov several times a week, and then as soon as they said, they made a news release that said it's coming within the next month, I was on there every day.
Yeah.
Is it open? Is it open? Is it open? And as soon as it opened, I signed up. I think you really, you don't have to be that crazy maybe, but you do really have to be prepared, because they accepted such a limited amount of people, and it broke my heart that like 2 weeks after I got in, they announced that they were closing the trial. They had all the people they needed and they were closing it.
Yeah.
So unfortunately, that's the way trials work. And I know there's the other trials like Casalix that's out there right now. They accepted even less people than TransCon did. If you want to be in it, you've got to be prepared. You've already got to make up your mind that you're willing to do it before it opens up.
I also wanted to say, whenever a clinical trial comes out, if you're on our mailing list, you will get an email announcing what's happening.
Yeah, and continue to go back to our website all the time too.
Yeah,
So we have some questions.
Yeah, I do got a question. This one was probably for Barry. And she goes, could somebody that has been on both NatPara and TransCon, could you compare and contrast the experiences for us?
Yes, I was on NatPara from 2015 to 2016. I was never stable. Dr. Manstadt was my doctor, and he talked about split dosing. I wasn't very comfortable with that. And then I had an incident. I was able to do some things. I ride with my son across the Golden Gate Bridge while on NatPara, which was like a huge accomplishment for me. And that was amazing. But once I went off NatPara, my body never recovered until I started TransCon. And since I started TransCon, at times I've been able to rollerblade 7 miles a day. Not every day, some weeks every day, some weeks not at all. But that's something I was never able to do even pre-thyroid removal in 1998. So there is I do feel that there's definitely a difference in the medicine, and I feel alive. I feel like I can climb a mountain. I do really notice a big difference in the medication, maybe because it's long acting. I'm not really sure, but I definitely notice a difference. I know Michelle also had experience with NatPara as well, so maybe she wants to further explain.
So my experience with NatPara, I had a really good experience with NatPara. I was on it for 3 years. I only went off because of the recall. And then same as Barry, though, once I went off, my body couldn't recover. I was in the hospital all the time, couldn't keep up. But when I was on Natpara, my levels were stable. They never went like really high or anything. They were low normal. So it kept me just where I think I needed to be, because for 20 years prior to that, I was never above an 8, and they kept me in the low 8s, which was great. So I felt very stable in Natpara. Now with TransCon, I've been on TransCon now since May. So what is that? 5, 6, 7, 8, 9, 10, 6 months. And the last 2 months I've been hyper, which is a whole new ball game. For those of you who've been hypopara for a while, if you've never been hyper, I think I'd rather be hypo. The nausea is relentless. It's just a whole different world that I'm not used to navigating after 20 years of being hypopara. So I'm not sure how I feel about TransCon yet. I'm thinking it's because it's a trial and they just got to learn how to tweak it better and faster. But yeah, so that's the difference between Natpara and TransCon for me.
Yeah, because for a while you were feeling like amazing.
I was feeling amazing
Yeah,
the first
and then
few
when you
weeks
went
on it.
Hyper.
Yeah, now
Yeah,
I've been
terrified,
hyper
yeah.
and they can't seem to correct it. So
Yeah, so
it's
hopefully
tough.
that'll.
Yeah,
Yeah.
And
I think that
I'd
goes
like
show
to add,
Sure.
can I add that according to like my doctor, I visit my local doctor once a month regularly because I can't get back to New York. And she explained, like, she's in shock. She says, wow, every time. My heart rate has never been more stable. I've never had such a great resting heart rate. So TransCon has affected more than just my calcium levels. It's affected my heart, and my heart is doing great. And I'm thanking TransCon for that.
Very good.
And I was just gonna say, I think, you're looking at two completely different drugs, different amino acid chains, right? 1 through 34 and 1 through 84. And what TransCon you're hearing all these wonderful stories about TransCon, but for some people, TransCon might not be the answer. It'll be Natpara when Natpara finally makes it back. And so finding a doctor and an endocrinologist that is going to go to bat for you and help get you approved for these when they come out, it might be a trial and error, right? So I think having more than one option on the table is going to help even a lot more people than just having Natpara on the market. So I think it's going to be a really good thing to have multiple types of therapies on the
And just
market.
listening to not just, the Natpara or the TransCon, the other things that are starting to get into play too.
Mhm.
So
The
that'll be really
ADH1 and
nice. Yeah. Do we have
Yeah.
any other questions, Bob?
Let's see, has PTH treatment helped with blood pressure? Barry, I think you might have touched base on that one a little bit.
Yes.
Your heart rate's
hun-
better, so blood pressure's good.
Yep. Blood pressure's good.
Very good. Awesome.
Something that Bob just touched upon about you working with your doctor to decide whether or not Natpara or TransCon would be appropriate for you once they come to market. I think that is key too, even when you want to enter a clinical trial. So I asked my doctor before I even applied to TransCon. I said, because some of your doctors don't know as much, and we all know we're educating our doctors. My doctor seems to know a lot. They actually recommended me to try Natpara, but when I was thinking about TransCon, I went to them first and said, do you think this is appropriate for me? And are you okay with me seeking this out? I think it's a good conversation to have with your physician ahead of time.
Yeah, absolutely.
Yep. And then this one, and it goes to trials, but this is from Nancy. She says, I'm 76 and never can get into trials because of my age. Concerned that with what happens is symptoms of age are added to the symptoms of hypoparathyroidism. Are there any older people in trials planned?
Up to a certain, I don't remember what the age was on TransCon, but the one that I was doing when it was open, it was up to 70. So
It just depends.
Nancy, just keep waiting.
Keep looking at clinicaltrials.org.
I'll call you as soon as I find something.
Yeah. Yeah, very good. So anything else?
Just one more question. for Barry. She says, did you change your dose of TransCon PTH based on blood work or symptoms or both?
Yes, when I started the 1 month blind study portion of phase 2, I started at 15 milligrams, and last week, gradually over time, now I'm on 51 milligrams. So I have to do 2 injections, the 27 and the 24 each night. So the more I do, the more parathyroid hormone my body requires.
Yeah,
Okay.
yeah, very good. All right, so thank you guys for a wonderful day and putting up with a little bit of our technical difficulties, which will always happen in any kind of virtual situation. But I think we worked through really well, and there was so much great information that's been shared. Remember, on the documents, those are the documents in this EventMobi site that we're allowed to share. Some of the videos we'll be able to share, but that'll be a couple days later once we finish everything and are able to work on that part of it. But we appreciate your participation, the great questions, and we really just look forward to getting started with you again tomorrow. We'll start with our
Yep.
newbie chat with Deb, which was great this morning. And then we'll roll right into our day. So anything else, Bob?
No, I'm excited for tomorrow, man. I
Yeah.
think we're going out with a bang. We got an outstanding lineup with
Yes.
Dr. Manchtak, Dr. Levine, Dr. Clark,
Dr.
and
Rubin?
Dr. Rubin,
So
man. It's going to
excited about
be,
Dr. Clark.
Yes,
I'm
yes.
super excited to hear about Dr. Clark, too.
Yes,
His speech
yes.
on calcifications of basal ganglia.
Yeah, so we got a couple
Awesome
new
stuff
things
coming.
in our talks tomorrow,
Yeah.
so that'll be really great. So any final from you guys?
Get some rest.
Well, I just wanted to just thank Patty and Michelle for doing an incredible job, and Deb and Bob. I'm sorry I can't be there with you guys, but I'm there with you in spirit, and you're doing an incredible job. And I know that the entire community of patients, doctors, advocates are all very grateful for you as well. So thank you for all your hard work and bringing this to everyone.
Thank you. Thank
Thank
you.
you.
Okay, everybody, have a great night. We'll see you in the morning.
Thank you.